And how about after? I know patients on their post-op, they're kind of like, oh my gosh, the fat transfer, like it looks kind of crazy. Explain to me how that settles out. Because it does
Yes,
settle.
it does settle. Yeah, so the fat transfer to the breast does look bruised and red, and then the bruising turns different colors, and it really just looks like someone punched your breasts over and over again, honestly.
It looks very intimidating the first week, but it does get better, so much better.
And I do warn people because otherwise you see the redness and you were worried about infection and it's not an infection. You see the bruising, you worry about, I don't know, just it looks bananas. It looks a little lumpy. So as long as you don't put ice on the breasts and you stay in a light compression and you can start doing a little bit of massage, usually by 2 weeks, it's settling down and looks more normal. But yeah, you just have to be ready for it.
As Dave would say, having a rod shoved in and out of your breast. So why
Yeah.
do you suggest not to put ice on fat transfer areas?
So, what we want to do is increase the circulation to that area, and adding ice is going to decrease the circulation. It shrinks your blood vessels down. The cold temperature makes your body kind of bring everything to the center. And so that's decreasing the circulation. So, a lot of times we recommend ice. If you have just a straight augmentation, ice to that area will reduce swelling. But since it's also reducing circulation, we tell people that's a no no for any area of fat transfer.
Because that would decrease the amount of fat. Would you say that would kill off fat cells?
Yeah, you're risking, like, losing some of that fat that we've just transferred. You're decreasing
Absolutely
the servo.
not.
Yes, we do not
Do
want
not
that.
ice the fat.
Don't ice the fat.
That is your baby. Can you tell me a little bit about the recovery of this procedure? Like, how long would I be out for? How long would I need to take off work?
Yeah, so I tell people that as although if you're having a straight fat transfer to the breast, although your breast might look crazy those first few days, it really doesn't bother the patients. Like, people are pretty comfortable. And then the most uncomfortable part is just the liposuction, which after, a day or so, you can get up and move around. We don't want you getting your heart rate or blood pressure up for 2 weeks, but we want you moving around. It'll help get the fluid off and get the swelling down. And then after 2 weeks, you can work out if you feel good. There's no restrictions. I would say if you're working and you're doing a job where you're standing all the time, it really is the liposuction that will make you feel like you can't move around as quickly as you normally can. But for those patients that work from home, they just take a couple of days off and then you can sit at a desk and zoom in.
Yeah, I feel like that's a huge benefit that I hear from people is when you're doing just a fat transfer, you can just go back to resuming daily activities versus a breast aug where if they're going under the muscle, you're cutting that muscle. Mine was even after a week or two, it was so painful I could barely like drive.
Mhm.
My healing was a little bit different, but
Yeah, so definitely the recovery is faster for you just need to keep your heart rate and blood pressure down, but there's no restriction like we haven't messed with your pectoralis muscles, so there's no restriction with pushing and pulling and those sorts of things after that 2 weeks, where with breast augmentation, we do restrict your movement for 4 to 6 weeks because we don't want you to displace the implants.